Good afternoon. I'm Dr. Chris Rogers, and to be clear, I am not anti-marijuana. I do not support prohibition or criminalization of marijuana in Colorado. I do, however, support reasonable regulations to put a halt to unsafe practices that sacrifice the lives of Coloradans for reckless profit. And today, we're here to support House Bill 1317, which will take a powerful step towards this goal. First off, I'd like to thank Speaker Garnett and Representative Caraveo, as well as Senators Lundeen and Hansen for sponsoring this important bill. It's not always easy to work on sensible legislation regarding cannabis in Colorado, and I applaud their leadership and service. I'm the Medical Director of Child and Adolescent Services at the Medical Center of Aurora, the largely non-publicly owned psychiatric hospital in the state. Here I'm an inpatient psychiatrist with a front row seat to the emerging epidemic of cannabis abuse and addiction that threatens to swallow the lives of a whole generation of Coloradans. On our adult inpatient unit, it's hard to keep count of the number of psychotic and suicidal patients that are admitted with THC on board. And regardless of the data or clear evidence of how cannabis contributes to their illness, person after person refuses to accept that marijuana could be bad for them. How could it be? They've been taught to believe this is a harmless plant, a medicine that is good for anything from headaches to cancer to anxiety. It's natural, without side effects, without risk of addiction. This is the lie that is ruining the lives of far too many people in our state. The story on our adolescent unit is even more tragic, as we repeatedly treat kids too psychotic to know what's real, who they can trust, or where they are. The rates of adolescent psychosis have grown steadily since legalization, and in almost every single case is linked to the use of high THC potency concentrates. Products known as dabs, or wax, or shatter that are made in a lab by distilling down the most psychoactive component of the marijuana plant and concentrating it into what is better described as a hard drug than the weed people voted for in Amendment 64. Kids as young as 11 or 12 are using blowtorches and glass rigs to smoke these highly addictive and harmful chemicals, sometimes every night just to go to sleep. We have very little research to try and understand what this does to the developing brain, but as any child psychiatrist who treats these kids can tell you, we don't need a randomized control trial to see how dangerous and often tragic the effects are. We do know there's a clear risk between developing depression or even committing suicide related to earlier age of first use, as well as the potency of products. This means a 12-year-old trying a marijuana concentrate is at far greater risk of developing a mood disorder or even eventually killing themselves than a 30-year-old experimenting with a joint of flower. Unfortunately, it's far too easy for these 12-year-olds to get access to these products, and not from the black market or a shady drug dealer. They're getting them from friends at school or older siblings, many of whom have medical marijuana cards themselves and ready access to as much shatter, dab, or wax as they could ever want. It's time for this to change. House Bill 1317 will provide stronger safeguards to keeping cannabis products out of the hands of Colorado's kids. Having reasonable limits on daily purchases of these highly addictive substances makes good sense. Maintaining adequate guidelines for providers to uphold when recommending cannabis, especially to young kids, is a no-brainer. We need a more robust tracking mechanism to better understand who is using medical cannabis products, how much, and in what form. And Colorado should be leading the way in researching high-potency THC products. We certainly are leading the way in their sales. We have a long way to go to help the kids in my hospital, but House Bill 1317 is a great place to start. The whole country is watching Colorado as other states look to legalize cannabis. Let's lead the country into a sustainable and responsible future we can all be proud of. Thank you. And we're so excited that today the Attorney General Weiser is next up to speak in support of the bill.